of the first things that we were keen to talk about is, of course, you'll know that we've seen a relative lack of funding for mental health research specifically, traditionally, and it's been really clear for some time that we need a much more ambitious investment in mental health research. The last MQ report showed that the average spend per person on mental health research was £9 per affected person, compared to over £120 for dementia, over £200 for cancer. I mean, obviously, we don't want less to be spent on those things, but it really highlights the relatively small amounts that have traditionally been spent on mental health research. And so it's been great to see that the MHR have recently launched a number of new initiatives focused on mental health research. So we're really keen to hear what's driven this happening now.
So I'm keen to make it clear that mental health research is a strategic priority for the National Institute for Health Research, and we intend to ensure that funding for this important area just carries on increasing. So in 2019-2020, we invested 93 million, and there's a huge range of initiatives by which we plan for this to be increasing. We've traditionally had mental health research focused in a few areas, particularly sort of geographically, and we would really like to see this rebalanced in terms of funding, particularly reaching areas where the disease burden is highest. So building on that, a sort of partnership model and research reaching those underserved regions to make sure that the research really lands where it's needed most.
So can you tell us a bit about some of the current NIHR initiatives to build mental health research?
So in the summer, we announced the Mental Health Research Initiative explicitly, which was for funding calls across a number of different programmes, NIHR infrastructures and schools, both to expand current mental health research activity or to also look at how this research could be integrated along research into physical health. For many individuals, they're not, these two areas are not in silos. It's not my mental health or my physical health. So it's recognising that for patients and the public, these are often intertwined. So we're working with the NIHR ARCs, the Applied Research Centres, and the Patient Safety Translational Research Centres, and with other parts of the NIHR infrastructure, such as the MedTech diagnostic cooperatives, to really look at how we build capacity and capability, both within the programmes, but also within regions, so that we have the impact that we're looking for.
So yeah, we're really keen to hear more about the regional work. There have obviously been some calls recently that have specifically focused on mental health research in particular regions of the country, for example, the north of England. So can you tell us a bit more about the rationale for that and what NIHR is hoping to achieve going forwards?
We recognise that there was researcher capability in those areas, but that they weren't as well represented in our portfolio as we would like them to have been, despite us really recognising the burden of disease in those areas. So we put the call out to stimulate the researcher and the patient groups in those areas to really recognise what is going on and the wealth of expertise in that area. We were delighted to see the response and are going forward with funding. That doesn't mean we're withdrawing funding from other areas. We would like to see an approach that recognises the expertise and the experience across the country, and really builds on that regional approach to say this is research for everyone, not just for a few.
And you mentioned before as well about the sort of physical mental health divide, and certainly, I mean, so one of the other things I do is lead one of the UKRI mental health research networks called Emerging Minds. And in that, our stakeholders have very much emphasised the need for recognising the kind of complexity that the complexities of people's lives, and that often there are many co-occurring conditions, but our research often neglects that. So it'd be great to hear more about, how the NIHR is hoping to address this.
Historically, we've often considered that it's almost easier to do research in neat conditions, but people aren't neat. People are real, and they often have these overlapping conditions, which may be priority that come ebbs and flows in their life. So we can't see them in isolation. And if we research in isolation, we we shouldn't be surprised that sometimes downstream, when it gets to implementation, then our interventions don't work as we plan them to. So for me, it's really crucial that we work with real patients who often have these overlapping conditions. And for me, that's the key to the science informing the end impact. So we've really seen in the NHR that we've embraced patients with multiple long-term conditions as one of our key strategic focuses, and that we not only research those multiple long-term conditions in themselves, but ensure that all of our research is open to those. And that includes mental health conditions as well as physical. Again, coming back to what are the needs of people in the real world, not just in a rarefied research world. So I'm delighted that we're making this a focus, and would really encourage researchers to think about how they reduce the burden of taking part in research, so that we do encourage people who are already juggling a lot just in their clinical care to take part in research as well.
And I suppose as we look at sort of, more co-occurring, overlapping conditions, it really highlights the need for us to be bringing in wider groups of professions into mental health research, and which I think has probably traditionally been dominated by a relatively small number of professions. I mean, certainly in the Mental Health Research Incubator, we've got our map that people can map themselves on, so that we can help support networking and collaboration. And there are some groups with very few people on the map currently. For example, mental health social workers, a fairly small number of mental health nurses working in research, and other, there are other groups where we've got very small numbers at the moment. We're obviously keen to go out and find more, but I think there are definitely some professions where we see particular capacity issues. So it'd be great to hear, your thoughts from an NHR perspective about that, and what ways of addressing that.
So I think the NHR has led the way in this being in encouraging researchers from a wide range of disciplines, but there is plenty more that we could do. And we've started from our medicine base, but we've really looked at how we encourage those from a nursing, midwifery, allied health profession, but now very much going into the social care space. And also acknowledging that this is not a binary, you're not a clinician or a researcher. We would really like to make these schemes open to those who want to do both, because that's often where research with a real impact on practice can sit. I think the Mental Health Research Incubator has done so much work in this area to be a community that is welcoming and that can help people take those first steps and onwards. And one of the things we're really looking at in the NHR is to ensure that we cover as wide a range of disciplines at as wide a range of points in people's career as possible. So again, to say, go looking for what is possible and see how we can help.
And you mentioned settings there as well, because certainly social care is an area where I think we've seen a real shortage of mental health research, but it's obviously a critical area. Is there anything else you want to say about social care and how NHR is trying to build up research capacity there?
Yes, so I feel strongly that the where we've come from in terms of health research is now we're ready to really accelerate that in social care research, and that's because of the enormous amount of sort of foundation building that's been going on in social care research in the last few years, and recognizing the absolutely crucial importance of mental health research in social care settings, and we can't just divorce them in terms of, well, mental health research only sits in healthcare settings. Of course, that's so obvious to anyone who's working in that area. So we would particularly like to take those who are working in social care settings and say, come and see what's on offer. Use the Mental Health Research Incubator as your route in to find others who are curious and interested in making a difference to the care for people with mental health challenges, or and making a difference to the outcomes. That's, we've seen how that in COVID times has really driven a shift, both in care professionals and in the public. And I'd really like to see how we can capitalise on that momentum.
And one final thing I wanted to ask about, you mentioned the importance of bringing in clinicians into research from, across the country in different settings, but there's obviously another issue with bringing in participants into research who might have traditionally been underrepresented in our studies, who might be in communities that are underserved in terms of the provision that they receive. It'd be great to hear any thoughts you have about what we might be able to learn as mental health researchers that's what worked well in other parts of the MHR for really trying to improve representation in the research we do.
Yeah, research is for everyone. It's not for a small niche of society, but we have to understand how people engage with research and how we take the research to them rather than assuming that our previous used methods are fit for all. So there's a huge range of NHR work that's already looked at this, for example, through the Include guidance, which I think asks us to put ourselves in their shoes and look at how we engage on their terms in their settings, rather than just doing it as we've always done it. Interestingly, you might say that COVID has enabled some of this change because we've moved to more community settings, more remote working. We've moved to different ways of research delivery, but it starts by having those patient and public members not as an afterthought, but as the first thought. So asking what matters to them, how they would like to be involved in this research, and co-creators, co-designers, and how they get to determine what matters for them. And I think if we show that that's genuine rather than tokenistic, and that we are undertaking the research with them as partners on this journey, and by using what's available and what we've already learned from the NHR about how to do this, then I would be very much more optimistic that we can go forward with that inclusivity and diversity at its core.
Great, thank you. And certainly for those watching on the Incubator website, you'll find a really nice series of short videos about doing good PPI in mental health research. And also there's a whole section on developing a career as a lived experience researcher, and some really fantastic case studies that have been produced on lived experience research in mental health. So please do have a look at those too. Thanks ever so much for joining us, Lucy. It's been really good to hear your thoughts on all of that, and it's exciting to see the energy and enthusiasm that the NHR are putting behind building capacity in mental health research. Thanks very much for joining us.
Thank you for inviting me. It's a topic that I feel strongly about, and I really hope that over my time in this role in the NHR that I continue to see it flourishing.